Hello. Yes.
All right.
Yes.
Two people are popping on here. We'll wait just another minute or two. One more elevator, right? If we were in the sky room. And we are recording this from the beginning. Thank you, Elizabeth Middleberg, for helping with that. So for those who miss it, how's that going to be available, Elizabeth? You post a YouTube link or something?
If people want, we can post it as a YouTube link, but we're starting to populate our in-house channel. So it will run on our in-house channels starting in August in the afternoon, so that people who miss it in the morning can see it on the channel. But we can also distribute the link if people are interested.
You might distribute the link for those of us who don't have channel 64.
Sure, no problem.
Great. Good options. Thank you. It's nice to see everyone's faces and sometimes their beards and their shaggy hairs and all the other fun we got. John, yes, thank you. All right, as I like to do, I'll share the local data, share my screen here. There we go. The Alameda County numbers should be showing. If I draw out for our whole pandemic here, it gets to be a long graph. So I'm shortening it for the more recent couple months. And here we are in this territory. We had one big day here. We have to look at the 7-day average, so which is about 160 new reported cases per day in Alameda County. So I'd say we're kind of holding steady. Doesn't look like we're increasing. If we look at the percentage of positivity, nope, wrong graph. Percent of positivity, we're hovering around 3 to 5%. So that's been pretty steady over the last, let's go on the same time frame here. Last couple months, 3, 4, 5%. The state of California is up here at 7% or so. So we're doing better than average in general. Hospitalizations in our 9 area county hospitals are currently at 171, down from an average back here of about 90 or 100. So we're up, but we still have plenty of hospital capacity. So if you get sick, don't worry about going to the hospital. You should go. They have COVID rooms. They have ICU beds. ICU has not increased all that much. Back here from about 40, now we're running at about 50 plus or minus. So there's still plenty of beds available at the hospital of choice. So, and elective surgeries are happening. We've had a couple people go out for an eye surgery, for a hip surgery, and pacemaker. So those things seem to be operating fine. You'll probably just need a COVID test before you get accepted back in, which we can do for you now pretty quickly. And so those are my screens. I will how do I unshare here? There it is. Okay. My face is back. I'm keeping an eye on the chat screen if anyone has a question, or just pop in and wave me down and unmute yourself.
I'm waving you down.
Go ahead.
You can hear me.
Yeah.
Yes.
Okay, good. I'm thinking of the 14 members. We've had 14 members who tested positive.
Yep.
And they've all been quarantined and they're on their way back. Is that correct?
Yeah, so let me just recap.
My question is, the team members are negative now. Were there, the family members, were they actually sick or did they just test positive too? In other words, if a team member was asked to take a leave of absence, was it that the spouse or the family member did actively have the virus or just tested positive too? Is
Yeah.
that a hard question?
It was a couple of questions, but let's see. When a team member tests positive,
Yes,
they have to isolate at home
yes,
until they're cleared and safe to return,
yes.
whether or not they're symptomatic. So the public health guidance tells us they have to stay home for 10 days minimum.
Yeah.
And if they're still symptomatic, still have a fever and their cough hasn't improved, it's going to be longer. So let's say someone tests and they have no symptoms, but they test positive today. We're going to count 10 days, keep them home. We're going to check in with them, make sure they're still feeling good and normal, asymptomatic. And on day 11, they'd be cleared to return because they should not be able to transmit that virus at that point. If someone has been informed that they've been in close contact with someone who tested positive, so let's say a friend or a family member, and they got a call from a contact tracer in public health, and we're told, you've been in close contact with someone who's now positive. They would give them orders to stay home and quarantine and wait out 14 days to make sure they don't become infected. So there's a couple different scenarios and timeframes. Sometimes it's 10 days, sometimes it's 14 days, but either way, folks here that have tested positive are isolated for at least 10 days.
I guess the question has been answered, that one or two of our team members has actually experienced being sick.
Yeah, and when that happens, it is been from a household or close contact of theirs who has also been sick. So that's the trend that we have seen here. Most people that we've tested to be positive, including the one resident, have all been asymptomatic. So that's just how this bug is going. It goes around so easily, and it's hard to tell where it comes from at times. Other times it's pretty easy to trace when the people are sick, and it's pretty obvious.
Yeah. So we've been fairly lucky, haven't we?
We've been lucky and blessed, and we are working hard to keep it that way.
Yeah. Thank you, Jim.
Thank you, Flossie. Okay, I've got Zinnia on the line, Don, Simon, Rena. Marion, go ahead.
Yeah, Dan, I have a question. For people in assisted living who are mostly just sitting in their rooms, we were wondering if it's possible that some activity could be started outdoors, either on the terrace of Oakmont or on the courtyard, possibly a bingo game that somebody from the staff could run. Could that be done with everybody wearing masks and proper distancing from one another?
Okay. Thank you, Marion. I'll let Zinnia unmute and discuss that.
Hi, hello. Unfortunately, right now, I don't really have enough staff that can run the events and activities. We do support the residents if they have some laptop, or if they need a laptop or attend to events. Then our staff can arrange starting the Zoom meetings. We are in the process of, we do have a couple applicants for the activity coordinator. So I'm hoping that we're able to find the right staff soon. We are really we hear you, and we are trying to get the right people as soon as we can.
I'd like to ask a question. Have the program coordinators been hired yet?
Not yet, Vanji. We did start today a pre-screening, so we're hoping to have 3 potential candidates. So we're getting resumes and we're reviewing them and we're scheduling interviews.
Okay.
I'd like to go back to the question of the people on assisted living. Not enough people to do the activity is one sort of question, but it does occur to me, your question reminded me that these people haven't been outside for probably a couple of months. I mean, isn't there some way that they could at least, maybe in small groups, but residents would be, I'm sure, happy to talk with them if they can just come downstairs and sit around a table in the courtyard or up on the roof for a little while. I would think that having just a chance to see the sun and have fresh air would mean an awful lot to people, aside from whether there's any specific activity or not. The activity is a great idea, but I can understand it might be hard to organize.
If everybody would look at Kevin's data, or the one that came out on Wednesday, and look to the part about Walnut Creek, Tice Valley community there, that it went from 0 to 12 people passed away, 130 infected, including team members. That is always a fear of our leadership team, and it's hard to justify anything outside of the box of what we're doing now when it comes to safety. No one here has, well, we had 1 resident test positive, but as for the most part, our community has been safe. And it's been safe due to the reason of the things that Daniel and Zinnia and Kevin and myself have put into place. And so when we talk about going outside and meeting in small groups, we try our best to accommodate those things. That's why we've put chairs outside of the community on the side grass areas. But to gather in masses, meaning more than 12 or more than 10, it's just, it's not worth the chance of anybody getting sick and then having it spread rapidly through the community.
Well, I can understand that point for just one more. I can understand that point with regard to like a bingo game or something, but many residents, thank heavens, have been coming downstairs or to the roof and talking in groups of 3 or 4 people with distance, with masks on. It seems to me that's perfectly safe, but if it's okay for residents, I don't see why it shouldn't be okay for assisted living people. It's true.
Are you in assisted living to see that what they're doing up there, John? There have been people that have gone to the roof and spread out and talked a little bit, but to authorize a full event or something other than like what we do for Hootenanny, it's taking a chance that's really not necessary.
Well, at least my point had absolutely nothing to do with having a big event. That was the bingo point. My point was just encouraging people to come and sit around and talk maybe with other residents, non-assisted living residents. I don't think it would be that hard to do. If you're saying a lot of people are doing it, then it's fine. I mean, but I don't have the impression that that's happening very much. Maybe
well, residents are not locked in assisted living, and there are some that just as before they get out and about and they're free to do that. Zinnia, go ahead.
And also, yeah, and you have to understand the residents in assisted living are not locked up, okay? Everyone can leave at any time. And we have a couple residents who need some assistance with that, and they either have private duty and they do take the residents out. There are residents that they just want to stay in their apartment and we can't force them out. So, and you see it. You see residents that leaves their apartment and they can leave at any time. And residents are being seen every couple hours, 2 to 3 hours around the clock with our staff. And we do have residents that we support for either the Zoom meeting with their family members. We can set it up on, we have families that see their their family members every week. It depends on their needs. They go see the residents outside of Piedmont Gardens, so they are not restricted. Most of the residents that stay in their apartment prefers to stay in their apartment. If you have any concerns, if you know anyone that feels that they need some help, please connect with us because we can accommodate and we can assist the residents. We're really trying to discourage the independent living coming to assisted living. We have some residents that are not very active and they get exposed from you guys, from us going to their apartments. So if you have any concern, please reach out to us first before you try to help the residents.
Even our team members are separated. Those who work in the health center eat lunch in the health center. Those who work in assisted living, they stay upstairs and they eat in assisted living. The break room itself is closed. Only a handful of team members are using the courtyard because our objective is to not cross over. So the team members don't eat lunch together and then go back to different departments. That would be crossing over. So we have everyone separated best we can.
Yeah. There's a chat question here about the hairdressers coming back. So we have floated the idea and brainstormed about bringing one of the chairs outside and trying to cut hair outside with masks on. And there's still some challenges to getting that to happen. And we need to get permission to do that. We haven't been able to swing that solution yet, but it's on the table as a question. So we're not letting go, but we haven't got to yes yet on that. There are some salons you will find that are doing their work outside. I noticed one up Piedmont Avenue the other day behind the dry cleaning Green Bubble, Mr. Green Bubble up there. And they had an outside chair and someone was there getting their hair done. So you could probably find a place if you're desperate, but we don't have anything in-house yet.
Daniel?
Yeah, go ahead, Sheila.
I have a test question. Now, if you have to have even a minor procedure outside, you're asked to get a COVID test first, usually. Is that something we now can do in-house, or do we not have the testing capacity to do that?
Yeah, we do have the testing capacity in-house now, and we have a good system in place. So originally, it was kind of a weak system that we had with the lab. So we got a new lab and that system is much stronger. Our nurses are well trained and have all the supplies in hand. So we're running over 200 tests a week now in-house with residents mainly in the health center and staff mainly in the health center and a mix of staff in other departments. So those results are coming in between 2 and 5 days, mostly on the 2 to 3 day range. So if you need a test, we can get that and the lab will bill your insurance. They'll bill your Medicare or your Kaiser. So that part seems to be working well. Vanjie, you unmuted. Did you have a comment? No? Okay, I'll mute you again.
I'd like to ask a question about asymptomatic people.
Yeah.
How do they get cleared? If they're asymptomatic, how do you clear them? I mean,
the clearing is a waiting period. So the CDC says they should be isolated for 10 days to make sure that they don't develop a full-blown infection, which would be seen by symptoms. So after a 10-day waiting period, if they remain asymptomatic, those folks are considered safe to return to work.
they're not retested at that point?
No. The problem is we were doing the retesting before and they found out some people just keep testing positive, which means their virus or viral particles are still in their system but they watched them over long periods of time and they never actually got sick from the COVID. So they realized that the retesting was not so meaningful as much as the symptoms and the time period. So, you know, most infectious diseases can be spread by asymptomatic carriers. It's nothing unusual, except that this disease spreads so easily, so rapidly, and some folks get so sick from it, you know, deadly sick. So that's the difference of this. And so the 10-day waiting period is what we know right now.
So would they still be able to transmit the virus after the 10 days and they don't have symptoms?
We don't know. We don't know. After the 10 days, all the research says that there's been no transmissions that have been recorded. So the folks that have been watched by public health and their close contacts have been watched, they don't appear to be transmitting it after 10 days. There's no guarantees, right? So we still want to do the masks and the social distancing just to give ourselves insurance when something like that happens. But we think they're safe after 10 days.
And that's why we were asking everyone to try to limit your exposure and only leave your apartment if it's really necessary, because we, you know, it's still under studies. We don't really know what's going on with COVID. So it's just a precautionary, just limit your exposure.
There's a question here from Dave about getting approval for the hair cutting. The approval there, Dave, is the state has approved outside hair salons and barbers, but the county has still restricted that. So if we're going to give the final go-ahead to have our hairdressers back and move it outside, we like to consult with our county public health to make sure they're okay with that, and then it's a safe plan. So that was the answer, was the county. Hannah, can we have a review of what dining serving packages go where? Each piece described soup, bottom, top, salad, sandwich packaging. Simon is on the phone. Simon, can you unmute? Simon, question about food packaging. Okay, I bet Simon got interrupted while he's on this call. So we'll come back to that question, Hannah. And
sorry, I did get interrupted.
Okay. Go ahead, Simon. Do you see the question in the chat?
I can pull it up real quick. Give me 1 second.
Yeah, from Hannah. We're talking about, I'm guessing, refuse and recycling.
If you want, I can email that, but otherwise it's quite a long list. I'm not sure if you want me to go through it right now.
Well, my concern is that I have observed it not being followed, and I thought it might be helpful if people had a review of what it should be, because I think everyone likes to be doing it correctly, but they are not.
I think that would be probably better. It sounds better in email. So maybe we can blast that out, or Kevin can include it in his next memo.
Yeah, I'll include it in Kevin's next memo, because otherwise it's gonna become very busy.
Yeah, thank you.
Great, thank you, Simon. Other topics on food and dining while we've got Simon on the phone. Food and dining questions. No, how about programming questions? We've got Rena, we've got Elizabeth.
Daniel?
Like Gerald has a question.
Yeah, go ahead.
I actually had a question for Simon. We have gotten periodic
mailings on the nutrition content of various meals, but it is sort of sporadic. I was wondering if we could make that every week, that we could get the mailing on food nutrition. It's very helpful, especially for people on diets, sodium content, things like that.
Yeah, I was trying to figure out a better way to distribute it. I'm thinking maybe the best way is just do it via Kevin's Monday morning or Kevin's weekly email blast versus some other way. We were trying to think of a way maybe through either John, but I'm thinking since Kevin's email kind of goes through everyone, we'll go through that route.
Joy?
Yes, Simon, can you include the sugar content for the diabetics and pre-diabetics? I noticed it wasn't on there.
So the sugar content, there is no added sugar, but there is total carbohydrates listed as capital CHO, which will be your total sugar content.
Thank you.
Dave?
I have a question about whether this information that people are wanting, is that going to be on Cubigo? And if so, when would that component be added, i.e. the nutritional data, et cetera?
Whenever Cubigo becomes live for the entire community, we will upload both the menus and the nutritionals at the same time. We were talking with Cubigo that maybe when you click on a specific item, it'll display that separately, but we're still trying to work how that'll look exactly.
Okay, thank you.
Sounds like that's going to be a good platform for some of these things.
Question here.
Yeah, Flossie.
Simon?
Here.
Honey, can we take it easy on the cucumber? The cucumber is a very nice vegetable, but it has very little nutritional value, and I think it has no value at all. And it isn't exciting to eat. So when we order a green salad or any salad, 1 or 2 pieces of cucumber is okay, but like 10 pieces is too much. So can we take it easy on the cucumber?
We will take
something else to do with the cucumber.
We will take it easy on the cucumbers, but the cucumbers are still a good vegetable and they do have a lot of vitamins, minerals, and fiber with very minimal calories.
I mean, even after it's peeled?
Yes, even after it's peeled.
So it does have a lot of minerals?
Yes,
I wish I could taste them. Thank you.
Yes, it has potassium, fiber, vitamin C, vitamin K, magnesium, potassium, and vitamin A.
Goody, 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 goody. And let's see if I can get it from kale, okay? So
I'm going to send you extra cucumbers, Flossie.
Hey, Flossie, don't push it.
Oh, shut up.
You're clearly
For
not.
for those interested in that topic, the dining committee meeting will be coming up on, I think it's the 3rd Tuesday of August. And
August 18th.
everybody, all residents are invited to the Zoom dining committee meeting, and we could certainly go into any of these
We
issues
can
then.
talk about cucumbers.
Even more, if you like. You're more than welcome. You're on the dining committee, so you can certainly come.
Thank you, dear. Thank you.
I hear a cucumber poem come up.
I see Helen unmuted.
Yeah, I end up on cucumbers. I end up cutting the skin part that's on there. I think it's very pretty, but I don't think it agrees with me. So when I get my cucumbers, I cut off the little skin part. So am I losing nutrition?
Yes, I bet you are.
There's definitely going to be a little bit of loss of fiber, but not entirely. Most of the fiber is located in the skin part, but there's some located still in the flesh part of it, especially when you have the seeds with it.
Isn't it easier for you to just cut off all the skin, or are there people who really like a little bit of it?
Generally, cucumbers are both half skin, half off, just for the appearance.
Yeah, they're pretty. Yeah.
Helen, send it to Flossie.
On this topic, Simon, if someone wants a dietitian consult, they have questions, how should they get that? Dietary consult, Simon, if anyone needs one?
Sorry, I got interrupted. For dietary consult, they can contact the Wellness Center to email us, or they can contact us directly via email or phone numbers. You can call the dietitian, our dietitian Rachel, and leave her a message on the phone, and we'll get back to you.
Okay, so give you a call or shoot you an email or call Wellness.
Yes.
Okay. Great. Any more comments about cucumbers? Too bad, I'm moving on. Okay, what else do we have? Other questions from the floor?
Did you get your fortune yesterday?
Fortune cookies?
Yeah.
Yeah, that was about the most serious fortune cookie I've ever tasted.
You missed me. I didn't get one.
I didn't get one.
Uh-oh.
It wasn't a
Got
fortune.
one, and it said life is better with cucumbers.
Well, mine said, don't trust anybody in the place.
I forget what mine said, but I like the cookie.
It was good, wasn't it?
Yeah.
It was good.
I've never had chocolate dipped ones before.
Never will again, probably.
Yeah, right.
Do we have any left, Simon, if a couple people missed out on their goodies?
I will check. I think we do have a little bit left over.
I forgot to take a picture of Stephanie yesterday, but thank you to Banji. She lent us her beautiful outfit, and Stephanie was wearing it yesterday while we distribute the fortune cookies to our assisted living residents.
That's a 120-year-old gown.
Oh my goodness.
All hand
Beautiful.
in China. And one day I will give it to the Oakland Museum. In fact, they are expecting it.
How fun. All right. And the hootenanny, was that good yesterday?
I enjoyed it.
Man liked it. I don't know if the audience did.
I hope the audience did, but we enjoyed it.
It looked like the audience did.
I think we did.
Oh, there's Simon. I see your face. What do we have? Another cookie?
One
Right.
of the chocolate fortune cookies.
One left. First come, first serve.
Okay.
Yeah, I have another question.
Go ahead, Marion.
Yeah, it's for Zinnia. You know, what we seem to be getting the feeling in terms of people in assisted living is that the ones that squeak a lot get a good bit of attention. And there's so many that don't talk up. I don't know why exactly, but I'm wondering, you know, the issue of taking people outside for a little bit of air and a little bit of company with all the necessary precautions. I'm just wondering whether, you know, they get asked every day whether somebody would like, you know, every afternoon is beautiful around here. And I'm just wondering whether the people who in the morning maybe say no, they don't want to go out, might get another invitation in the afternoon because it's so nice and because they haven't talked to anybody except the staff that brings them their food for a considerable amount of time. Is there some kind of push or incentive to make the quiet people also enjoy some of the activity?
So we pretty much know who are residents and who prefer to stay home. And the one that's out, they usually have our private duty that goes out with them. We do have Stephanie who tried to invite residents, pretty much the same people that always say they're happy, they're okay in their apartments. And you know, you're not here all the time. So resident comes out of their apartment. So they go out, they either stay on the lounge or, you know, sometimes you see them on the first floor. Sometimes they go out. So each one has, you know, we don't force it, but they have the right to leave anytime they want. If you hear any residents that really complain to you, please let us know. And, you know, we can continue to reach out to them and see if we're able to help them. I know we do have a handful that's very stressed on the activities and all that. And so, you know, we try to reach out to them and talk to them, but even though we're reaching out, it's, you know, it's just a habit, I think, that, you know, they like to talk, and that's fine. But if you're concerned, please let us know and we can try and, you know, assign someone that can really check them on a regular basis just to make sure that their needs are attended.
Yeah, I think that would be a good idea. If people get an invitation every afternoon that the sun is out, to have the opportunity to go sit outside and meet with a few other people at the proper distance with a mask on, somehow they wouldn't assume that they need to be sheltering in that same damn old little place that they're stuck in. If it becomes a regular request to go and catch a little bit of sun and catch a little bit of company, people might begin to take it for granted. And if you have enough staff to get a few people out at a time, that would be nice. Actually, I'm wondering about that, whether of the people who do not have extra CNAs, you know, one-to-one services, if some of those people can be taken care of by the regular CNA staff and get an invitation for getting out. Do you have enough people to take people out for a little change of scenery?
Yes, we do. Also, I don't usually announce it, but we also have, we work with Monica, and we do have residents that we identify that needs walking. And we do have a private duty that walk the residents on a regular basis. We don't, you know, we don't announce that to everyone, but we do have residents that's regularly being, you know, do the regular walks with our private duty. So anyone that we feel that needs that kind of one-on-one, you know, help, then we try to assign that to a particular private duty who does the regular walking. And that's, you know.
There's an extra charge for that?
No, that's just part of assisted living.
Oh, good.
So just let us know if you have any concern. You know, unfortunately, we can't give you all the details or information about what we're doing with our residents, but you know, let me know if you have some concerns with particular residents.
Bonnie, I see you unmuted.
I'm in assisted living, but I don't feel as though I can't go out. I mean, out of the room. I mean, I go down, sit down in the courtyard, read a book or something. When it's a nice warm day and I want to get outside and have a little fresh air. But I don't feel as though I'm assigned to, I mean, I'm not capable of taking myself out there.
Yeah, but you're kind of special, Bonnie. And there's a lot of people, I think, who do not have the capacity or the will or the incentive to get themselves out. It takes effort and it takes some organization, and that's not everybody's luck to have.
Yeah. Well, I appreciate all the advocacy on this topic. I do want to get any updates from Don if we have any project updates, repairs updates.
Nothing new since Monday. We're still moving forward with the balcony project, and the roof decking project for Oakmont is on the table now, and that's gonna happen soon. And Luce, everybody knows Luce downstairs at the front desk. She's celebrating 29 years today of service to Piedmont Gardens. So if you get a chance to see Luce in your afternoon walk, congratulate her. And Zinnia, how many years have you been here, Zinnia?
24.
24 years of experience.
Yes,
Wow.
I'm turning 25 next year.
There you go. Thank you. A lot of experience in assisted living.
All right, last call. Anything else before we wrap up today? Okay. Thanks all very much. This is recorded, so if anyone hears about someone who missed it, refer them to Elizabeth Middleburg and we can connect you with that recording. So have a great, safe day. See you next time.
Thanks, Daniel.